welcome to Carolina Women. We are here today at Lava Fitness. We are joined today by our friend Maria. It is great to see you. You were like, she was congratulating you. And Dr. Robyn May, it's so good to see you.
Thank you for having me.
Yes, from ROC Dental. You know, in preparing for this and all of us sort of talking together, we got involved in so many conversations that we felt would be really important and pertinent to a lot of our viewers. So we thought it'd be interesting quickly just to kind of, how long have you been in practice?
So I graduated in 2020, the COVID year,
Exactly.
the COVID era. So it's been about 4 years of practicing.
And so we were talking before in our previous segment about sort of the basics, prevention and things that are really important when it comes to dental hygiene and just dental health in general. And we took a break and then we came back and we're like, oh my gosh, I think it'd be interesting to talk about oral cancers and things that you're seeing now in today's world.
Absolutely. So one of the reasons that preventative care is so important is each time you come in for your hygiene appointment, your dentist will do an oral cancer screening, and we go in and we look at all the tissues.
Yeah, what does that look like?
So we palpate along the jaw to check all the structures of the jaw. We look.
What does that mean?
We're
swabbing?
feeling.
Like I just want to go like this.
Yeah, like you're swabbing and it's a test?
It's a
or?
little mini massage for the
Okay,
face. So we're going to feel along the jawline, we're going to feel everything, we're going to look at the tissues, and then we're going to look internally, obviously, and we're going to look at all the gums, we're going to look at your tongue, we're going to look at under the tongue, the back of the tongue, some of the high risk areas, of course your palate. We're going to cover everything to make sure that there's no concerns, no ulcers, no areas that could potentially be malignant.
It's so interesting. So it's basically something that a lot of people don't even know that you're doing.
Absolutely. So a lot of people will say to me, oh, I haven't had a dentist do this. Some dentists will announce it. Hey, I'm going to do your oral cancer screening now. I am one of those people. I want my patients to know that when you come in every 6 months, I am looking for any changes.
Well, and I've heard that gum disease and some of these oral cancers, gum disease in particular, can really impact your overall health.
Absolutely.
Can you tell us a little bit about that?
Absolutely. There's a huge correlation between heart health and issues with your gingiva. And so really... Gingiva, yeah,
Okay.
your gums, I'm sorry.
Okay.
Absolutely.
Oh, don't worry about us, we'll ask.
There's a huge correlation there. So it is super, super important that you don't think your mouth is a separate entity to your body. It is very important for your oral and systemic health.
What are some symptoms that would make someone like maybe pause and think maybe something's going on, my gum health isn't good?
So if you're flossing and you're bleeding, that's a sign of inflammation.
Okay.
You've got to come in and let us take a look. If there's inflammation there, we've got to get your teeth really, really nice and clean.
Okay.
It doesn't always mean that there's bone loss in the mouth, but it could be.
Is it possible to be 71 and not have bone loss or if people take care of their teeth, is aging an automatic?
No, absolutely not. So if you are not flossing and not maintaining your teeth and not going to your dentist, it's like pouring, it's a problem.
Yeah.
It's like pouring gasoline on a fire. You don't want to expedite what's
And
already happening.
Smoke, vape,
Absolutely.
Yeah, the
zins.
Oh my gosh, all these, anytime you're introducing smoke into the oral cavity, that's not a good thing.
Okay.
You would never, if you had a wound on your hand, you would never blow smoke into it.
No, you wouldn't.
Imagine if you had a little wound in your
Yeah.
mouth and you're just chronically smoking. That's not healthy for that wound, and it's more likely to become a malignancy or something that becomes worse.
So talk about self-care. I mean, really taking care of your oral hygiene is one of the most important ways to practice self-care that you can.
Absolutely. I would say it's right up there with your wellness check with your primary care physician, except we see you twice a year. You see your physician once a year, but we should see you at a minimum twice a year and to check on everything. And the oral cancer screening is a part of that. And of course, making sure you don't have any cavities that are there and need to be treated. And things like that.
You were an amazing interview. We really appreciate you taking time to chat with us.
Of
And even
course.
doing a second segment, so thank you so much.
You're very
And stay with us. There's a lot more to come here in Carolina Women.